Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering obsessive compulsive personality disorder. There is a difference between obsessive compulsive personality disorder and just obsessive compulsive disorder. Okay, there's a difference. So I'm going to be talking about that. Make sure you guys know the difference. Before I even get started, please support my channel. Support me, guys. Like this video. Subscribe to my channel if you haven't done so already. Share my video with a friend, a coworker, a classmate, a nursing instructor. Don't forget I have audio lessons available for you on my website, nexusnursinginstitute.com. And tomorrow, August 21st, 11 a.m. Eastern Standard Time, I'm having my first YouTube live session where I'm going to be going over priority and delegation. It's going to be a multi-part series, but it's going to be the first part. And actually, in that first part, I'm going to make sure that I also cover test taking strategies. Very important, because you're not always going to know the answer, but if you know certain tricks, even if you don't know the answer, you can still choose the correct answer. So make sure you guys watch out for that tomorrow. All right, guys, let's get started. Obsessive compulsive personality disorder, different than OCD. Look what it says. So it says obsessive compulsive personality disorder is characterized by limited emotional expression, stubbornness, perseverance, and indecisiveness. They have a preoccupation with orderliness. Everything has to be in the correct space. And when I say correct space, the space that they feel is the correct space, okay? They have a preoccupation with orderliness, perfectionism, I can't speak, perfectionism, and control. These are the hallmarks of the disorder. So guys, those three, you absolutely need to know. Again, orderliness, everything has to be in a certain order, in their order. Perfectionism, if one thing is off, it's a problem. They're perfectionists. And control, they have to control their environment. They have to control everything around that. Those are hallmarks of this disorder. Now remember, when it comes to personality disorders, whether we're talking about obsessive compulsive personality disorder or antisocial personality disorder, or dependent personality disorder, or avoidant, whatever, if it's a personality disorder, there is no cure. There are treatment options, but no cure, okay? And so patients with personality disorders are hard to deal with. It's hard for them to keep relationships, whether it's platonic or romantic relationships, just because of those types of personality disorders. Let's keep moving on. Let's keep going. This is seen more commonly in men than in women. Look at this. Oldest siblings tend to be affected more than the subsequent siblings. That's interesting. Risk factors for this disorder include a background of harsh discipline and having a first-degree relative with this disorder. And I put a star next to that because across the board, guys, when it comes to psych, 99% of these disorders always have a very strong genetic link. And so you're expected to know that. The main pathological personality traits are, look at this, rigidity. That means they are unbending, they are unflexing, they are unwilling to compromise. Rigidity and inflexible standards of themselves and the people around them. Projects are often incomplete due to overly strict standards. They can have a project but they hold their standards so high. Everything has to be so perfect, they're never even able to finish it, because they keep doing this one part over and over and over again because it has to be perfect. And as you guys know, nothing ever can be perfect. A distinction should be made between OCD and OCPD. There is a difference between obsessive compulsive disorder and obsessive compulsive personality disorder. And what we're talking about right now is the personality disorder, okay? Look at this. OCD, obsessive compulsive disorder, is characterized by obsessive thoughts and repetition or adherence of rituals. So let me stop right there. The patient with OCD, by the way, obsessive compulsive disorder, this is an anxiety disorder. They're anxious about whatever it is. They have anxiety, they're anxious, and so they feel like their life is out of control, so they have to control what they can. And so they have these obsessive thoughts. They'll think about the same thing over and over and over and over again, Or they'll have this behavior that they repeat over and over and over again, such as walking around the house and turning off the lights a million times, or checking the locks a million times, or going throughout the house and checking the sinks to make sure that the water's not running a million times, whatever it is. That's the OCD, okay? Obsessive compulsive personality disorder is characterized by an unhealthy focus on perfectionism. Sorry, guys, you know I can't speak. You know it. It's been years. You're used to it. I'm sorry. Perfectionism. Do you see the difference? So the person with OCD, they have these obsessive thoughts and behaviors that they have to do repetitively. But the person with obsessive compulsive personality disorder, their healthy focus is on being perfect. They think their actions are right. Look at this. And they feel comfortable with such self-imposed systems of rules. Let me tell you something. The person with OCD, obsessive compulsive disorder, they understand that these actions are not healthy. They understand that these actions are not normal and they want to stop. They just don't know how. But the person with obsessive compulsive personality disorder, they don't see anything wrong with the prison that they've created for themselves or the people around them. Okay, that is the biggest difference between these two. Nursing care and guidelines. Nurses should guard against power struggles because remember, the person with obsessive compulsive personality disorder, it's all about control. All of that perfectionism, all of that, it boils down to control. They want to control themselves and they want to control you. So do not enter into power struggles with the patient. Patients with this disorder have difficulty dealing with unexpected changes. Remember, they don't even think anything's wrong with them. Provide structure, yet allow patients extra time to complete habitual behavior. So what we're going to do is try to get them to stop this type of behavior, but slowly. You can't get it done in a day. So what you're going to do is wake them up a little bit earlier so that they can still complete whatever that behavior is, but still go on about their day and fulfill whatever amount of tasks that they have to do for that day. And as each day goes on, you make it shorter and shorter and shorter so that you can decrease those habits that they have while the patient's still being allowed to complete all of their activities of daily living, okay? Assist patients to identify ineffective coping and develop effective coping techniques. They need to realize that this is not normal. Number one, they need to realize it's not normal. And then, okay, what can I do when I start to feel anxious or I start to feel like I'm out of control and it's starting to bother me? It's starting to bother me. So instead of driving the next person crazy by telling them that they have to do it my way or the highway, what are some other effective ways to decrease my anxiety level? Okay, so that is the guideline for nursing care. Let's take a look at treatment options. Group therapy and behavioral therapy, they can be helpful. The patient can learn about new coping skills and how to decrease levels of anxiety. Anafranil can reduce obsessions, anxiety and depression, and fluoxetine. Oh, let me scroll this down for you, sorry. Fluoxetine, Prozac, this is an antidepressant that also, guys, can be effective. And guys, that is your OCPD in a nutshell. That's the most important things that you guys need to know about it. Let me know what you thought about this video. Please don't forget, like this video, subscribe to my channel if you haven't done so already. Share one of my videos on your social media platforms. You never know who's in the nursing program that is struggling, that might need my help. Guys, thank you so much for watching this video, and you guys will catch me on the next video.